Just want to talk through some basic mobilizations, manipulations of the talo-curl joint and show some small little tips to make this simple mobilization manipulation technique even easier. So a couple of tips to start is you want to have the patient's leg positioned where the malleoli are on the table and then the talus is off the table. So scoot down for a second. So this would be a more incorrect way to do it because now the table is not blocking his malleoli. Scoot up that way, a little bit further. And again, this is going to be harder to do a posterior glide of the talus because now the table's in my way. So get really picky about where the patient's leg is positioned. So come down an inch or so. That's good. So now the table's blocking his malleoli and the talus is free to go posteriorly. So work on that positioning for one. Second thing is I want to stabilize the proximal part of his tibia as much as possible to make it a cleaner opening at that talo-curl joint. So I recommend almost pushing the whole leg into the table with the bare skin exposed and not have clothing on because the clothing will slide. And sometimes even what I'll do is put a piece of TheraBand or Dyson underneath the leg to make it stick on the table even better. So my overall force is going to be into the table so that his calf sticks on the table. I don't need to use my hand to stabilize the talus, stabilize the tibia as I pull from here. So take the time to get that tibial part of his ankle in the correct position. The next thing is I want you to get your mobilizing fingers on the talus. So with his ankle in a resting position here, I'm going to make sure I get on that anterior talus. I like to do hand over hand for my positioning. So once I get my finger on that anterior talus, then I will bring him up into his position of dorsiflexion towards his barrier. I think it's important to get on the bone first and then get in position, as opposed to getting to the barrier and then trying to get on the talus. So get on the talus and then bring him up into his position of his barrier. The next thing is with his leg in this position, my barrier now is not talo-curl joint, but more of a gastroc stretch because his knee is straight. So what I'll do is just put this foot underneath here if you can. In this position now with his knee slightly bent, I can actually achieve more of an ankle end range of motion and not just a gastroc end range. So make sure you're at the joint range of motion, not the Achilles tendon gastroc end range. Tibia is in position. I'm going to push into the table. I'm going to sequence where my fingers are on the talus, and then I go into position. And then from there, I want to make sure my elbows are in nice and tight to my body. It's very difficult to do the manipulation out here. It's much easier in this way. So you can notice that the patient too is sitting in a long sit position, but not in a position where there's dural tension. So you don't want to have them in a full upright long sit. Either have them supine or long sitting with their hands propped back so they're not in a position of any dural tension. All right, so I'm going to get them in position here. Is that okay? On your foot. And I can just mobilize with some traction, pulling his talus towards me and posterior towards the table, getting myself in a nice upright position. I can either do a straight traction technique, pulling towards me, or I can do more of a J-stroke traction with the posterior glide to restore dorsal. Again, you can mobilize. So okay, if I give it a quick pull, I can go to that end range, back off a little bit, and then pull quickly to manipulate the joint.